Okay, so reconstructive breast surgery. This may be indicated, as you can see in the example here, especially the before photo, in a complete mastectomy. So it's a reconstruction of a breast that's been removed due to cancer or other disease. Primarily it's cancer, but there are other pathologies that may lead to that type of excision. It's often performed immediately after a mastectomy. When they say immediately, it makes it sound like in the same surgical operation, and that's not entirely true. They might be able to place some adipose tissue in that area during the original surgery to help start building the mound, and that's my understanding that that is somewhat of a practice. But the idea that a person's going to go in, have a complete mastectomy, and then wake up with a replacement breast in place is not realistic. And that is exactly why, I point this out because it's exactly what this next statement says. The patient awakens from anesthesia with a breast mound already in place. So that's what I'm referring to there. They might displace some adipose tissue from a different part of the body and put it in that wound area in order to start building a mound. But in terms of the actual reconstruction, it's much more involved than that. So anyway, this is one option. I've seen female patients who have had this done and others who had, I remember distinctly doing an EKG on a female patient who had a bilateral mastectomy. And of course, I always drape the patient before I hook up the leads and work underneath the drape in order to give them privacy. And she threw the drape on the ground. It was the first time I'd saw scars from a double mastectomy. And she was very open about it and told me all about it. For her, breast reconstruction wasn't even an option. Didn't interest her. She said, I'm glad to be done with them. So different tact on that for everybody. Point is, if there is a complete mastectomy, there is a reconstructive surgery that can happen if the patient chooses to proceed with that. Okay, so two combining forms for milk. We have lacto for milk, and galacto also means milk. Lactation is the secretion of milk for the nourishment of an infant. So that has to do with, if you look at a more detailed anatomical picture of the breast, you'll see that it's full of lactiferous ducts and glands that look a lot like lymph nodes, as a matter of fact, and this is where milk is produced and secreted. Galactorrhea is a secretion of breast milk in women who are not breastfeeding an infant or in men. So, two things I want to point out here. Men can, in rare instances, depending on of course, anatomical and physiological structures, produce milk. So it's not exclusively something associated with female anatomy, although it's quite rare. It does happen. I've seen one case of it in my how many years as a medical assistant. And the other thing I wanted to point out is in regards to the last several slides, when we're talking about breast cancer, men are also at risk for breast cancer. I've seen 7 cases of breast cancer, one that ended in a fatality or in a death. The patient didn't survive it. Male breast cancer. So it's not uncommon for men to have breast cancer. It's found fairly frequently. You can certainly look up online and find cases of it. And so just to be aware, it's not extremely frequent, but it's frequent enough to be of concern and definitely something we want to pay attention to. A combining form, NATO, is a combining form for birth, as in natal, pertaining to birth. And of course, our specialty is neonatology. This is a study of newborn infants, neo meaning new, nato meaning birth. Gives us a couple of other words here. We have neonate, which is a newborn infant up to about a month of age, and neonatal, which means pertaining to a newborn. So once again, that would be in and around 30 days after birth, of course, depending on the specifics of the situation. If it's a premature birth, the neonatal period may be longer than 30 days, for example. And our specialist, neonatologist, a physician specializing in the study, care, and treatment of neonates. So that is our specialty. You probably saw that one coming because every specialty has its own specialist, correct? And pre and post, we've seen these before, but we're going to put them in conjunction with the previous combining form. So prenatal means before birth. Postnatal means occurring after birth. And another term that refers to being after birth, and specifically after childbirth, but it's in reference to only the mother, is postpartum. For you moms out there, you've probably heard this word, and others you've probably heard it as well. It's fairly common. So this is a reference specifically to the mom. We'll talk later about a couple pathologies that are associated with pregnancy, and as I mentioned earlier, can happen as much as 6 weeks postpartum. or postnatal, however you want to look at that. But those would be postpartum conditions. Okay, suffix, we had this at the beginning of the semester. Gravida means a pregnant woman. And Preemie gravida borrows from the Italian language, Preemie meaning one. Preemie gravida is a woman who's pregnant for the first time. Multigravida is a woman who has been pregnant more than once. There's some classifications to that, or some caveats to that, because that's only talking about pregnancy in that last example. So Preemie gravida, multigravida, those are referring to just pregnancies alone. They don't refer to the birth. Para is going to be our suffix that means to give birth. As in nullipara, a woman who's never given birth. Primipara, a woman who's given birth to one viable infant. And multipara, a woman who's given birth to more than one viable infant. And that could mean more than one child in one pregnancy, or that could mean consecutive pregnancies throughout a lifetime. So it just simply means they've given birth more than once. Technically, if there's twins or triplets, those are 3 births, even though it's happening in one interaction. Something to note here, because we mentioned the word viable infant, and at the bottom we define that. Viable means the fetus has reached a gestational age of 20 weeks, regardless of whether the infant was living at birth or whether it was a single or multiple birth. So it doesn't necessarily mean, unfortunately, a live child is born. And that's a sad thing to think about, and I don't want to dwell on it, but that is part of the definition. So it's important to understand that these terms may apply to someone who still does not have a child living on this planet with them. It just means the gestational age was 20 weeks. So multipara, primipara, they can be deceiving. Never look at those in a chart and assume that there was a live birth that occurred. And that is a really good tip. I was given that advice by a doctor once, and I've always been very careful around that topic, because there were a few times in my career when I could have possibly said the wrong thing. And I would never want to bring up something that personal from a patient's life without them giving permission firsthand to discuss it. And they would give permission by bringing the topic up themselves. Or if it was medically indicated and we had to ask. But that would be more the doctor's role than it would be a medical assistant. Could be a nurse's role. Okay, so pseudo means false. Cyesis means pregnancy. So pseudocyesis is a false pregnancy. This is a woman or a man, and it has been documented, that believes that they are pregnant. So for a woman, of course, that's a possibility. For a man, it's a long shot, but I'm never going to say never, because what do I know? It may have, so the person may have many or all of the symptoms associated with pregnancy, but there's no baby present. Some men experience also what's called sympathetic pregnancy, which means that symptomatically they share some of the same things that their partner is going through. Some of the side effects of pregnancy, the restlessness, the cramping, the mood swings, all the sorts of things that you associate with pregnancy. Well, some men will have those symptoms develop as well, and that's known as a sympathetic pregnancy. They're not going to give birth any more likely than any other man would, but they are sympathizing and empathizing with their partner enough that they're sharing those symptoms with them. IVF, in vitro fertilization. This is the process that manually fertilizes an egg with a sperm outside the body, and it happens in vitro, which means in glass. Then they transfer the embryo to the uterus. These costs are not current costs. They're much, much higher. This is old data here, $10,000 to $15,000. The last person I knew of who did this was a student who shared her story with me, and she was doing $35,000 per implantation. And it took her 6 implantations to actually become pregnant. So she was well into it, close to $200,000. You could almost get a down payment in Santa Cruz for that kind of money on a house, right? So given our expensive real estate here. She was determined to have a baby. She had the baby. I've seen the baby, and she's so wonderfully happy. So it worked out. Keep in mind that for that, if you're paying $10,000 to $15,000 per implantation, or up to $35,000 or more per implantation, there's a 15 to 40% success rate. So kind of like baseball, when you go up to bat, chances of you striking out are much stronger than you getting a home run. Same with IVF. The chances of it failing are far, far higher than succeeding. Yet, if you have the resources and want the baby and want to pursue it and have a doctor that's willing to go through with it with you, then more power to you. Go for it, and good luck. Hope it works out. Amnio is a combining form to describe the amnion, which is the amniotic sac. The amnion is a thin membranous sac filled with watery fluid known as amniotic fluid, which encloses the embryo or fetus. One of the things I love about this picture is that however we are in the world, we all started our lives like this, inside a very safe, fluid environment with our mothers, and peace, tranquil, hopefully. Everyone's story is different. But we all had this moment of development when we were inside our mother's bodies, and we all share this in humanity. And to me, this is one thing that if it doesn't really unite us, it should, because of the thought that we all arrived here via the same means and had the same experiences, whether we want to admit it or not. Kind of means we're all sort of on the same playing field, regardless of how you feel about anything else about another person. We all shared this moment in our lives. So here's a procedure that's involved with the amnion, amniocentesis. You already know centesis means surgical puncture. You're probably wondering why that's happening here, especially if there's a life at stake. Well, amniocentesis, the definition, surgical puncture of the amnion to remove fluid. It's done by ultrasound guidance to make sure that the fetus isn't disturbed. They test the fluid for genetic abnormalities, biochemical disorders, maternal-fetal incompatibility. There are, and I have heard stories, and I've personally had OBGYNs suggest that we get this done when my wife and I were preparing to have a child, and the question was why, and I said, well, wouldn't you want to know if your baby is going to be normal? And I went to a friend of mine who's a physician, and I said, how do I answer that? And they said, well, would you do anything about the fetus if you found out it was abnormal? And I said, no, we still want the baby no matter what. And then they said, don't do it because it's a high risk. In our situation, we had no risk factors. It was just something that someone had suggested that we do, kind of like the circumcision thing. Not to say this is not a required situation sometimes. Amniocentesis is very much indicated in certain pregnancies. However, if it's not indicated, there's no reason to do it. And if a doctor suggests that you should do it, it's always good to ask the questions. It doesn't mean that you have to refuse the procedure. It doesn't mean you need to do the procedure. This should be the mom's and conceivably the dad's decision as well. But if there's a clinical indication and it means the life of the mom or the baby in balance, it might be a good suggestion. So just a word to the wise on that one. Often we think if a doctor orders it, it must be done. Isn't always necessarily true. You can always ask questions. You can always ask for a second opinion. And that goes both ways, by the way, as a medical assistant or as a nurse or as someone who's giving birth. Questions can always be asked and should be answered. This is how we learn in medicine. Okay, some procedures around pregnancy. We have a transvaginal ultrasound. This is an ultrasound technique performed through the vagina. The ultrasound probe is placed in the vagina in order to produce a sharper image of the pelvic structures. And this is typically used in early pregnancy. I know later in pregnancy, they don't always use this particular method. Sometimes they use also transabdominal ultrasound. So this is an ultrasound technique performed through the abdomen. The handheld instrument is passed back and forth over the abdominal wall. It's called a transducer, by the way. High-frequency sound waves bounce off body tissues to produce an image, and it's used to evaluate reproductive organs and or fetus during pregnancy. And if you know anything about ultrasound, it's used to evaluate a lot of things. Ultrasound's wonderful. Like doing X-ray, it's non-invasive, and there's no radiation involved. Other side, the images aren't quite as clear and crisp as we might get in radiology. But there are certain things and certain times when you don't want to expose a patient to radiation. Ultrasound will gather the information that's needed, and it's highly indicated in those types of situations. So, every test appropriate to the risk-benefits ratio, I would say, on that one. All right, there's 15 minutes. I'm going to do a quick pause. I'll be right back, and we'll finish up the rest of the lecture on Chapter 8, Part 2, the Female Reproductive System.